Hasini, are you here?
Yeah, hi, I'm here.
Yeah, go ahead. Yes.
All right.
Yes.
All right, can you see this now? All right, so my topic was the neurobiology of bipolar disorder and the medication used to treat it. So one of the reasons why I wanted to choose this topic was because mental health is like a relatively new field in like the area of neurology, and many have like treated this condition but barely know what the medicine does or what it targets. So in doing this research, I wanted to demystify the etiology behind of it, and I wanted to highlight the roles of various genes and signaling pathways that were involved in this disorder. Oh yeah, I forgot to introduce myself. Hi, my name is Hasini Gokavarapu, and I am a junior at Bordentown Regional High School in New Jersey. Right. So for this paper, I wanted to mainly focus on signaling pathways, which is why you'll see a lot of familiar names. So for those of you who don't know what bipolar disorder is, it's a rare heritable mental health disorder that has a 4.8 worldwide prevalence. And it's primarily characterized by like violent mood swings between manic stages, which like involve like high amounts of anxiety, high amounts of agitation, aggression, and depressive stages, which is typically what you think of when you hear the word depression. And the severity of these stages forms different types of subgroups of bipolar disorder, such as bipolar 1, bipolar 2, cyclothymia, and unspecified. Right, so for my literature review, in the PKA pathway, antidepressants are frequently used to mitigate bipolar disorder. However, what many don't realize and what has come to light as of recently is that antidepressants actually do more harm than good in treating depressive mood swings because they can cause devastating side effects such as rapid cycling when one alternates between depressive and manic mood swings in a short time frame. Now, obviously, this can be a lot stressful for like the person who's dealing with this, and they can also trigger manic episodes. So this is why there's been a recent push to stay away from antidepressants in pharmacological contexts. Next, the WNT pathway, which I'm sure many of you have heard about if you've been researching like Alzheimer's disease, like various neurodegenerative diseases. So the WNT pathway mainly contributes to manic episodes. And so common mood stabilizers are frequently used to mitigate these effects of manic episodes. And it's been shown that lithium carbonate and valproate target the GSK3 beta protein and are able to regulate it. Additionally, they also target the PPARD gene and the GSK3 gene as well. Right, the PKC pathway. So in the PKC pathway, I found that there was a lot of overlap with the cholinergic pathway, which exists within the PKC pathway, and they have like overlapping responses. So in the PKC pathway, I mainly focused on discussions on like dopamine and serotonin. And so I found that manipulating the 5-HT serotonin receptors, specifically the 2A, researchers were able to observe behavior that coincided with that of bipolar disorder in monkeys. The PKC beta protein has also been found to be able to regulate D2 like dopamine autoreceptors. And so I'm sure like a lot of you have heard about like dopamine-based treatment for neurodegenerative diseases because dopamine plays a huge role in a lot of neurodegenerative diseases. And so many have thought of recently to like apply that same treatment to bipolar disorders. So stimulant-like agents, stimulants, dopamine agonists, and partial dopamine agonists are of recent interest. And finally, the cholinergic pathway, which so a correlation between like depressive patients having like acetylcholine like concentrations that are fluctuating from the normal levels of cholinergic activity have been observed, as well as a negative correlation between acetylcholine activity in red blood cells and the number of past suicide attempts. And so, many have noted that too little acetylcholine has been shown to cause depressive symptoms. So people and researchers have discussed ways to treat certain conditions that have been caused by disruptions in acetylcholine activity. So there are direct and indirect acting varieties. So direct acting varieties, they bind directly to the muscarinic receptor in order to promote more acetylcholine transmission. And the indirect acting varieties send acetylcholine molecules near their respective synapses in order to increase neurotransmission. Okay, and so the primary goal in the research was to analyze neurological causes of bipolar disorder and mainly focus on a biological viewpoint apart from other external triggers such as childhood trauma and traumatic incidents. So this was a secondary literature review. I did take some steps to make sure that the data presented was statistically significant by running p-value tests with an alpha level of 0.05, just to be sure. And then I did a qualitative review of each pathway's main function and role in bipolar disorder. And so the results. Medication, as I've said before, medication targeting the PKA pathway shouldn't really be considered a viable solution for depressive mood swings as it causes more harm in bipolar patients than it helps them. Increasing acetylcholine concentration near synapses, binding acetylcholine directly to the muscarinic receptor may be a viable alternative to this, which is why I mentioned acetylcholine. Lithium and valproate can inhibit GSK3 beta, as well as the AKAP11 gene, which has been found to have several mutations that can cause errors in the way that GSK3 beta acts, and the PPARD gene in order to alleviate symptoms of manic mood swings. So as a result of this, because of this, we can discuss alternative treatments such as like gene therapy, CRISPR, in order to reduce the phenotypical chance that bipolar disorder is expressed. Yeah, so I basically kind of said most of this. So my contribution to the topic was that I wanted to offer a perspective that is usually not seen in clinical contexts when discussing bipolar disorder, because a lot of mental health disorders are frequently stigmatized by the media we consume, and there's often a lot of misinformation floating around. So I kind of wanted to demystify that through this research paper and then talk about other factors that can cause it. So, my experience working with gifted Gabber was pretty life-changing, honestly. Like, I didn't think I was capable, like, I knew I was a good writer, but I didn't think I was capable of making a research paper to this caliber. And I soon learned that I am, thanks to people like Dr. Jobin Varkey, who helped me learn a lot more about like the etiology of various neurological disorders, and also helped me make connections from his topics to mine. Additionally, Professor Torimoka guided me through like the research process step by step, and helped a lot in discussing formatting, page length, content, and overall was a pretty smooth experience. So thank you to everyone at Gifted Gabber for aiding me through this journey. Any questions?
Yeah, really good presentation and the topic and the depth at which you've gone in. It's a topic that you can stop sharing. You can it's a controversial topic, and I'm pretty sure and Dr. Varkey can chime in, but you did a great job in the amount of time that was provided to you. So kudos to you, Dr. Jobin.
Good job, Hasini, like going through the like underlying pathways for bipolar disorder and all. Uh, uh, Going in the same line with the previous talks that we had today, did you also look into the diet aspect of how it can mitigate the effect of bipolar? I mean, you can't like treat it like that, but at least like whether you can mitigate it by changing the diet or maybe some natural extracts and all. Have you looked into that too?
I haven't really looked into that. I mainly focused on like actual medicine and like stuff like that. Though that really would be an interesting avenue to explore, and I wouldn't be opposed to doing that.
Okay. Yeah. Otherwise, like once again, like congratulations for like going deep into the mechanistic aspect of the bipolar disorder.
Yeah, great
Good job.
job, Hasini. I look forward for your paper, like submission and getting it approved, because it's a pretty good topic. Okay, so a big round of applause for Hasini, and two questions.